Today, Dr. Tiffany Randolph with Cone Health Heart and Vascular at Drawbridge Parkway is here to help spot the signs before it is too late. So let's get right into it. We hear the terms hypertension and high blood pressure. Are they the same thing?
Great question. They are the same thing. So when we talk about blood pressure, we think about two numbers. The systolic is the top number. That is how much force your vessels feel every time your heart squeezes. And then the bottom number, or the diastolic, is how much pressure is left inside the vessels in between heartbeats. A totally normal blood pressure would be less than 120 over 80.
120 over 80. So that is kind of where we need to gauge ourselves. So if they went to the CVS and stuck their arm into the thing, they should be looking for that 120 over 80. All right, so what is happening in our body when we have high blood pressure?
Unfortunately, many things. So when your blood pressure is high, it puts unnecessary force on all of your organs. So there's increased pressure on your brain, on your heart, on your kidneys, and all your blood vessels. And over time, that can lead to increased risks of heart attacks, strokes, heart failure. It makes you more likely to have end-stage kidney disease where you might need dialysis. It even raises the risk of developing dementia.
Okay, so we called it the silent killer at the beginning, and that is because a lot of people don't even know that they have high blood pressure. At what point should you be tracking your blood pressure?
Oh, great question. So really, by the time you're 18, assuming you don't have any other risks, you should be getting your blood pressure checked at least once every couple of years. So that means if you're not obese, you don't have diabetes, you don't smoke, or any of those types of things, at least every couple of years. If you develop any of those risk factors, or by the time you're 40, you really need to have your blood pressure checked every year. But if you already have high blood pressure, then it might be very helpful to check it even more frequently, especially as you're needing to make any medication changes or things like that. Because we find that actually people's blood pressure sometimes might be higher in the office than it is at home. That's something we call white coat hypertension. And so if your blood pressures aren't as high as at home or in a more restful setting, then we may not need to give you as much medication. We also sometimes find that there might be patterns to your blood pressure. So if you're checking your blood pressures in the morning and the evening, you might see a pattern that would help us to decide what's the best time of day where you should take your blood pressure medications.
Okay, yeah, it can be one of those things, you get nervous when you go to the doctor's office, right? So your blood pressure raises, that's kind of a normal thing. So also had to check it at home. When you check it at home, you should do it in a certain way.
Yes, so it's important, first of all, to make sure that you sit and rest for about 5 minutes. Even small exercise, just walking around your house, things like that, will raise your blood pressure. So you want to sit in a comfortable position with your feet flat on the floor. When you check your blood pressure, you always want to make sure that the cuff is at heart level. So you can sit at your kitchen table, you can sit on the side of your couch and rest it on the arm. If you have your arm up in the air or hanging down, it really will alter your blood pressure.
Okay, good to know. All right, so what are the dangerous complications that could happen if you have high blood pressure, especially for a long time unchecked?
So hypertension, everywhere you have a blood vessel in your body, it can wreak havoc. So it can cause problems with vision, it can cause strokes, dementia, it can cause heart failure, heart attacks. It even can cause peripheral vascular disease, difficulty getting blood flow to your legs, and increase the risk of amputations and other things that, of course, none of us want.
No. Okay. So would someone who maybe isn't checking their blood pressure regularly, would they have any kind of indication that they might have high blood pressure?
So, like you said at the beginning of the segment, unfortunately, it's the silent killer because most people really don't feel anything when their blood pressure is elevated. Some people are more attuned to their bodies, and sometimes once your blood pressures get really high, you might feel symptoms like fatigue, you may have nosebleeds. One really common side effect is headaches or even shortness of breath. But again, many times your blood pressure has been very high for a long time before any of those things might come up.
Right, and you're thinking fatigue and you're thinking headache, you're thinking those are things that I just get because I'm stressed at work, and you might not really be correlating them with your health.
Exactly right.
Okay. All right, we're going to take a quick break, but we're back talking about high blood pressure and hypertension in just a few moments. Dr. Tiffany Randolph with Cone Health Heart and Vascular at Drawbridge Parkway is with us, and we're talking about high blood pressure, hypertension. So we talked about how at 18 you should start checking your blood pressure at least once a year, but how often should adults check their blood pressure depending on their age?
So, interestingly, the risk of hypertension goes up significantly with age. So, by the time you're in your 60s, half of the population has high blood pressure. By the time you're in your 70s, it's actually three-quarters of the population. So, this means that as we age, by the time you're 40, really have to be checking that blood pressure at least once a year. And interestingly, hypertension affects different races significantly. So, people of African descent are much more likely to develop hypertension and to get it at a younger age. So even in your teens, 20s, 30s. And so for this population, it's especially important to check because not only are they more likely to have high blood pressure, but they're also more likely to have what we call resistant hypertension, meaning it takes 3 medicines or more to get the blood pressure under control.
Right. We want to avoid those medicines if we can. So one more time, let's go over what is considered a normal blood pressure reading.
Normal is less than 120/80.
Okay. And what's considered high?
So this is such a moving target. So if you have known cardiovascular disease, if you've ever had a heart attack, a stroke, if you've got kidney disease, diabetes, or if your risk of those things happening is high, meaning 10% or more in the next 10 years, or if you're African American, your blood pressure should be less than 130/80. If you do not have any of those risk factors and the only thing you have is high blood pressure and your overall risk is low, then less than 140/90 is considered an acceptable target to aim for.
Okay, but once 140 hits, I mean, that's it for everybody. You need to be talking to someone. So I guess that's my next kind of thing. When is it time to call your healthcare provider versus when is it time to call 911?
Good question. So symptoms are always key. If you are having high blood pressure readings, meaning, 160s, 170s, 180s, and you're having chest pain, shortness of breath, if you're having severe headaches, or if you have any stroke type symptoms, for instance, if you have sudden onset of slurred speech or blurry vision, if you're having weakness, numbness, tingling on one side of your body, those are all reasons to call 911 emergently and not drive yourself to the emergency department. However, if you see an alarming blood pressure reading, like say 180/120, it absolutely needs to be addressed urgently. Hopefully, you can get in to see your primary care provider. If not that, then you can consider urgent care. But if you're not having symptoms, you don't necessarily have to go to the emergency department right away.
Okay, but you do need to make sure you get in with your doctor sometime soon.
Absolutely.
Okay. Now, if someone is at high risk or has been diagnosed with high blood pressure, what kind of steps should they be taking to lower their risk and maintain a good, healthy blood pressure?
This is the $1,000,000 question, right? So I tell patients all the time, my goal, and I'm sure your goal too, is to control your blood pressure with as few medicines as possible. And so that means that if we're not going to take medicines, we have to put the work in from a lifestyle standpoint. So the first thing is thinking about our diet, limiting caffeine intake. I would never take anyone's 1 cup of coffee away, but try to keep it under 1 caffeinated drink per day. The other things that we watch for are sodium. So we recommend following something called the DASH diet, which means keeping your sodium under 2,300 milligrams per day, which is actually really hard to do, especially if you eat out. So cooking at home as much as possible is key. Trying to use fresh and frozen vegetables. Anything that can sit on the shelf for a year and not go bad probably has too much salt in it, and they're using that as a preservative. Other things to watch out for are alcohol. So really, for women, maintaining less than one drink or less per day, less than 7 over the course of a week. And for men, less than 2 drinks a day, no more than 14 over the course of the week. All of these things can contribute. Some things we don't think about too might be sleep apnea. So if you have sleep apnea and that's untreated, it also makes it really hard to control your blood pressure. And last but not least, exercise, right? We have to move our bodies. If you can move your body 150 minutes per week of moderate to vigorous exercise, that will give you over time just as much improvement in your blood pressure as any one medication can.
All right, we got about 1 minute left. Who should someone contact if they're concerned about their blood pressure or if they think they might be in that high risk category?
So absolutely start with your primary care provider. We actually, this in the last 2 years, developed what we call the Advanced Hypertension Clinic at Cone. And what we do is we serve as a resource for people who are at really high risk and are struggling to get their blood pressures under control. So, if you do have resistant hypertension, if you are on 3 meds and still can't get your blood pressure controlled, if you're really young and don't have other risk factors and have developed hypertension, it's worthwhile to make sure there's no other underlying things that could be causing your blood pressure to be high. So start with your primary care provider, and if that's not controlling it, we are happy to see you at the Advanced Hypertension Clinic as well.